Hello, and welcome to another vlog. This week's theme is anxiety disorders. Tune in to Thursday's video if you want to learn more about that, and don't forget to subscribe. Today there are 3 things that I'd like to talk about. First, I'd like to debunk a few common anxiety myths. Then I'd like to talk about some of the different types of anxiety disorders. And finally, I'd like to talk about one of the most common treatments for anxiety disorders. So without further ado, let's jump right into it. So there's 3 main anxiety myths that I'm going to address today. I'm going to tell you the myth, and then I'm going to tell you what the actual facts are. So the first myth is that people with anxieties should avoid the things that cause them fear and anxiety. Now, the fact is, the best course of action for someone with anxieties is to learn to face their fears and cope with the things that cause them anxieties. That's because obviously avoidance is not always possible, nor is it practical. Furthermore, trying to avoid the thing that makes you anxious can just cause more anxiety. So the best practice for someone with anxieties is to learn to cope with the thing that makes them anxious, and there's actually a lot of treatments that are built specifically around that process. The next myth is that people with anxieties need to be on medication to control their anxieties. Now, this is a harmful myth because it creates the impression, it gives the impression that people with anxieties, that there's something wrong with them. The fact is, there's nothing wrong with people who have anxieties. And there are many different treatments for anxiety disorders, some of which do not involve medication. There are many people with anxiety disorders who do not require medications to control their symptoms. Then again, there's also some people with anxieties who do, and there's many people with anxiety disorders that receive a combination of treatments, for example, both counseling and medication. It really depends on what that person's diagnosis is and what their specific needs are and which treatments work for them, and that varies from person to person. The point is, there is no one-size-fits-all treatment for anxieties, and that includes medication. So the third myth is that exercise can help control or prevent anxieties. Now, this is kind of similar to one of the myths I talked about last week about depression. But just like with depression, the fact is exercising cannot prevent people from developing anxieties. The reason being is there are many different risk factors that can lead to the development of anxieties, and for the most part, exercising does nothing to alleviate these risk factors. For example, anxieties oftentimes runs in families, so they believe that there is a genetic component to it. Exercising isn't going to change your DNA. And then another risk factor for anxieties is stress or trauma. Everyone faces stress. It's just a regular part of life. There's ways to reduce stress, but there's no way to completely eliminate them, even if you exercise every day. And let's be honest, exercising isn't relaxing for everybody. It is for some people, but not for everybody. So just like with depression, anxieties cannot be prevented or cured through exercise. This brings me to the next thing I'd like to talk about today, which is the different types of anxiety disorders. There's 5 different types of anxiety disorders that I'd like to talk about briefly, so I'm going to just talk about each one now. So the first disorder is called generalized anxiety disorder, or GAD. Now, GAD is a very common form of anxieties. It tends to be characterized by a number of symptoms, including intense worrying, irritability, restlessness, and insomnia. Sometimes it can even be accompanied by physical symptoms such as muscle tension. Now, generalized anxiety disorder, the symptoms tend to last for extended periods of time, often months at a time. And that's one of the things that really separates it from some of the other conditions. So the next anxiety disorder is called panic disorder. Now, panic disorder, as the name suggests, is characterized by frequent and unexpected panic attacks. So if someone with this disorder is put into certain situations that cause them anxiety, they might have a panic attack. And oftentimes, it's when these panic attacks occur when least expected. And panic attacks can be quite scary for people who have this condition, because when someone has a panic attack, oftentimes their heart rate will increase and they'll find themselves short of breath. And this can also be accompanied by other symptoms such as sweating or trembling. So they can be very, very scary. Then there's social anxiety disorder, also known as social phobia. So people with this disorder tend to have fear of social situations. So they tend to experience anxiety during social situations, and for that reason they oftentimes avoid those situations. This can lead to difficulty forming and maintaining relationships, and people with this disorder are often self-conscious, so they worry about being ridiculed or rejected by other people, and that just adds to their fear. Now, this is a disorder that a lot of people on the autism spectrum uh, may have symptoms of, but it's not just people on the autism spectrum who can experience this kind of anxiety. The next condition is called obsessive compulsive disorder, and this one's very misunderstood. A lot of people think OCD is more of a quirk, like, oh, I like to color in between the lines. That's not what OCD is at all. That is, perfectionism, which is a quirk, but OCD is a lot more serious. So, obsessive compulsive disorder is characterized by obsessions and compulsions. An obsession being a very disturbing and uncontrollable thought, and then a compulsion being basically an impulsive ritual that they perform to try and manage these disturbing thoughts. So, for example, someone with OCD may have a disturbing thought that their family is going to die, and to help eliminate that anxiety, they'll perform some irrational ritual to try and prevent that from happening. So it might be, um, repeating certain words or counting or something that is oftentimes completely unrelated to their fear, to prevent the thing that they're worrying about from happening. And the thing about people with OCD is a lot of people with OCD realize that these obsessions and compulsions are unrealistic, but they're not something that they can control. The point is, having obsessive compulsive disorder is quite a serious thing. And then the final disorder is called post-traumatic stress disorder. This is one that people oftentimes hear about as well. Post-traumatic stress disorder, or PTSD, tends to develop sometimes if someone experiences a traumatic event, traumatic or violent event. And if it does develop, which can happen years after the trauma, it tends to be characterized by very intense flashbacks and nightmares, and just very intense anxiety in general. It can affect their emotional state, and it can just be a very, very debilitating disorder, which is, like I said, and as the name suggests, caused by a traumatic or violent event. So that's a pretty severe condition as well. So you can see there's a lot of different anxiety disorders. Now, I don't claim to be an expert on any of these disorders because I'm not, but everything that I've told you is based on the research that I've done. The last disorder, which I'm just going to mention but isn't really on this list, is specific phobias. So a phobia is basically an irrational fear of something that oftentimes presents little to no danger. So for this type of phobia that we're talking about, these irrational phobias, it could be a fear of flying, for example. And so that can cause intense anxiety. But I didn't really include this on the list too much because it's a little bit different than some of the other anxiety disorders. This brings me to the last thing that I'd like to talk about today, which is the different kinds of treatment for anxiety disorders. Um, Specifically, I want to talk about one treatment in particular, which I've mentioned on this series before. It's called cognitive behavioral therapy, or CBT. Now, CBT is a common form of what they call talk therapy for anxiety disorders, as well as a number of other mental illnesses and other conditions. But anxiety disorders is one of the main things that it's used for. So essentially, with cognitive behavioral therapy, the goal is to help the patient develop strategies to rationalize their thinking. So people who receive CBT will usually go and see a psychiatrist, and the psychiatrist will walk them through the therapy at each session. Depending on the person's specific needs, they'll usually have 10 to 20 sessions, sometimes more than that, sometimes less, but that's the average. And basically, what happens is the process is to first identify one's negative thinking, and then to develop strategies to change their way of thinking. So the first step is to identify those thoughts, and then the second step is to decide whether or not those thoughts are rational or not, and then the third step is to replace those unrealistic thoughts with more realistic ones. And this can be a very difficult thing to do because it requires a lot of, thinking and soul searching to come up with, to identify your way of thinking and change it so that it's not as harmful. So I personally did use this therapy when I went to see a psychiatrist last year for the anxieties that I have. And what we did is we sat down and we identified the anxious thoughts that I was having, and then I was asked to take those thoughts and determine whether or not they're rational, and then come up with new ways of thinking. So this can be done in a number of ways. It's really about asking yourself, is there another way of thinking, a better way of thinking, right? So asking yourself, what is the likelihood that this is going to happen? Are these anxieties valid? Is this something that I should be worrying about? And is there another way of thinking about this? So for example, a good example would be, let's say you're at a party and someone ignores you. You might get anxious and think, oh no, that person doesn't like me because they ignored me. But using cognitive behavioral therapy, you can ask yourself, well, is this a realistic way of thinking? And is there another way to look at this? And you might decide, using your cognitive behavioral therapy, that perhaps it's not that this person doesn't like me, maybe they just didn't see me. That's just one example. There's a lot more examples. Anyway, my psychiatrist and I actually sat down and at the final session, we actually wrote up what's called a relapse prevention plan, which basically just listed those new thinking strategies that we developed, when to apply them and how to use them. And that's basically a brief overview of cognitive behavioral therapy. It doesn't necessarily cure the anxieties. The main purpose of it is to help people with anxieties manage those symptoms. And from my experience, it is very effective, and I also know from the research that I've done, it is one of the most effective treatments, which is oftentimes used alongside medication, but not always. So those are just the three things that I wanted to talk about today. I know it was a lot of material to cover, but I hope you found it as interesting and as informative as I did. And if you want to learn more about anxieties, disorders, and things like that, tune into Thursday's video. Like I said, subscribe if you want to see that. Also, be sure to like us on Facebook and follow us on Twitter. Anyway, that's everything for today. Thanks for watching, and see you on Thursday.